I worked in the HIV and AIDS clinic of National Hospital, and from there it was obvious how it was a struggle for people that have to take drugs on a recurrent basis to get access to their medications and stay on track with those medications. What you find in emerging markets like Nigeria and in Africa at large is that pharmacies are the first point of access, and that means people that have to take recurrent medications take at least 2 medications, and they have to visit these pharmacies every month just to get their medicines. This is very tedious, and it adds up to the low adherence in taking these drugs.
Each person has to find their medications at the right price, at the right time, right, on an ongoing basis. And our job is to first ensure that we help people find one place where they can order their medications, manage it, and automate refills.
So the way it works is when someone signs up to Famasi, we get the history of their medication use and also sign them up to curate care plans that are personalized to them. When we create these care plans on a monthly basis, they get their medication delivered to their doorstep with a care specialist who acts as their body medication use and checks in on them to ensure that all of the side effects, adverse drug reactions that happen during the use of medications are taken note of, and this is communicated to their doctor or other physicians ensuring their care.
We're trying to do this today via a user dashboard. This also now morphs into an ongoing interaction with a care specialist who sort of like helps them to find a personalized plan for their health. So with this, they can either, know when their medications are about to run out. They can properly track their medications. They can know when their consultation is coming, who to see, what testing to do, all from the comfort of their home.
So tech is an enabler to make it easy to manage medications for our customers. By offering access to remote monitoring, then people can get to speak with their caregivers, get to speak with their physicians without having to leave their homes, get stuck in traffic, lose productive hours.
Leveraging technology means the first approach is to try to do it via a smartphone. But we understand that this can be exclusive. And so as we grow, we're looking at building the foundation that allows us to first translate all of our offerings into local languages, and then also now ensuring that our technology is accessible via feature phones, USSD, and also partnering with existing agent networks to reach people in traditionally excluded environments.
I think that the biggest challenge, we call it non-consumption, it is that people do not want to take the initiative to even take care of their own health. They wait until it is too late before they start to look for their medications. People have health conditions that they have to take drugs for, but they wait until they have some symptoms before they even remember that their blood pressure is too high or their sugar level is dropping. And this poses a great problem because when you look at other challenges in the African space, logistics and all of that, in trying to care for people, there's communication challenges, all of these things that worsens when we wait until the last minute to actually pay attention to our healthcare needs. So yes, non-consumption is like the biggest challenge.